All right, so we're now due to speak here from Elise. Elise is from our Child and Adolescent Health Service, and she is going to come and discuss everything regarding paediatrics and neonates in WA. Welcome, Elise.
Thanks so much, Sarah. Thank you so much for joining us, even if we are running a little bit late. Firstly, I just want to say congratulations to you for getting far enough into your undergraduate nursing studies to be starting to think about where you would like to work post your studies. Recognise that that is super exciting, but also really nerve-wracking. If you've got a passion for children, for paediatrics, for working with families, then listen in, because I'm going to tell you all about the Child and Adolescent Health Service. Okay, so the Child and Adolescent Health Service is Western Australia's only dedicated health service provider for children and young people. CARS is unique in that it offers a range of services that support children from birth through to young adulthood, from caring for them when they're sick at PCH and in neonates, to helping them to have their best possible health outcomes out in community health. So as you can see on the screen there, we have 4 main service areas. So we've got neonatology, we've got the Child and Adolescent Mental Health Service, otherwise known as CAMS. We also have community health, which you might hear us call it CATCH, and we have Perth Children's Hospital, or PCH. So as you're aware, you've got some questions to answer as part of your selection criteria on the values. So I wanted to touch on what our values are for CARS. It is an expectation that anybody who is employed with CARS lives and breathes our values, and hopefully some of those values that we have here at CARS resonates to you in your own personal life as well, because that really helps you embed them into your practice. So our values, they define who we are, what we stand for, and how we behave. And as you can see on there, our values are compassion, excellence, collaboration, accountability, equity, and respect. So have a really good think about those values, which may resonate with you. And then when it comes to your application, letting us know really clearly why those values do resonate with you. So the way we work, so we have 4 guiding principles that we will apply to everything we do at CARS, and it helps guide every decision we make as well. So we are a child-first organisation, so we place children and young people and their families first and foremost in everything that we do. Safety and quality, we do not compromise on the safety and quality of the care that we provide, and we are committed to ensuring that all children and young people receive the best care that we possibly can. Professionalism, so we always hold ourselves to the highest possible standard. We take ownership and accountability of our own performance and work hard to continuously improve how we do things here at CARS. And sustainability as well, so thinking about the environment, we strive to use our resources responsibly. So what that means is that we are making sure that we are minimising wastage here within CARS, and there is lots of work that happens in the background to assist us to be able to do that. So just to talk or provide you with a visual of what it looks like to apply for CARS. So the Child and Adolescent Health Service essentially is the umbrella, and then underneath that umbrella we have our 3 streams, which are our 3 transition to practice programs. So one program is the Perth Children's Hospital and Neonatology program. We then have our Child and Adolescent Community Health program and our Child and Adolescent Mental Health Service program. So they are our 3 programs that all sit under the Child and Adolescent Health Service. So I'll talk firstly to the Perth Children's Hospital and the neonatology stream. So as you can see there, it's a 56-week or a 13-month transition to practice program. It includes 2 6-month rotations within the hospital, and you are contracted to 8 shifts a fortnight. Now, those shifts can fall anywhere from morning to afternoon shift to night shift within that fortnight. So it is not set days, it is shift work. We provide you with a really comprehensive orientation. So at the start of every intake, we have our PCH, our community health and mental health grads all start together. So we do a CARS induction and orientation first, and then we break up into specialised orientation within each stream where we teach you the skills that you're required to perform the role. For our PCH and neonate grads, there is a 2-week supernumerary period. So that means you're alongside another nurse supporting you while you get your sort of feet on the ground and get yourself running. As part of the program, we provide study days, Strive forums and simulation forums throughout the year. Simulation often makes us feel a little bit nervous, but all of our grads say how beneficial and wonderful it is to be in a really supportive, protected environment where you can practice those skills in a real life sort of simulated situation. But they are spaced throughout the year in a really great way to link that theory into your skills. We have a dedicated TTP team, so there is a nurse educator for the PCH and neonatology stream, and then under our nurse educator are clinical educators who help support the program and come and work with you one-on-one on the floor, and we also have staff development nurses within the program that are there to support you, and we have staff development nurses on all of our wards here that are there to guide and assist you. So a really supportive program. We do also have a clinical portfolio, and it is an expectation that that clinical portfolio is completed throughout the year. So your clinical portfolio allows preceptors to provide feedback, and it's a record of the skills that you have been signed off and that you're competent in, and it all links back to our NMBA standards of practice. So it's an expectation that you will complete that for you to be able to receive a completion certificate at the end of the program. Now, if PCH and neonates is your area of interest, there are 2 intakes. So we have our August 2026 and our February 2027 intake. On Grad Connect, when you apply, you will have to select that option there, the long lot of words. So public sector, child and adolescent health service, Perth Children's Hospital / neonatology, community health and mental health. So that's what you'll have to select as your option first, and then you'll be asked to preference which stream. So if it's PCH and neonates, that's where you will nominate the Perth Children's Hospital and neonatology. I recognise that maybe not all of us can stay and ask questions following this presentation, but you can see our contact details at the bottom of the screen there. If this has raised any questions for you, or you need some more information that you're unable to get as part of this virtual forum format, you've got our email address and our phone number there, which will connect to our office where you'll be able to speak to any one of the CARS Nursing Education team who can give you information about the program. Okay, so our second stream is the community health stream. So that is the stream that I coordinate. Now, we recognise that as part of your undergraduate studies, it is unlikely that you will have experienced community health. So just to give you a quick wraparound of what community health is, we are heavily based on health promotion and early identification and intervention. So we are working with our babies right through to about our 5-year-olds, where we're doing vision and hearing screening, growth and development. And our role is to focus on all of those areas to promote wellbeing during childhood and well into adolescence. So we are not dealing with sick children, we are dealing with well children that we are monitoring from a developmental point of view to ensure that they're getting the most out of their life and that they can go on to be successful adults, adolescents, and can function in our community. So we only have one intake, so it's a February intake only. It's a 12-month program and you're rostered 8 working days a fortnight. Now, the big difference with the community health program is that our shifts are the same, so it's set days, so it will be one of the 4 days within a working week. There are no weekends and there are no night shift. So really great if you're needing that flexibility or that structure to plan your life. As part of the program, you'll work in a variety of community settings, so largely spending time in primary school health, where we're working with 4 and 5-year-olds, and in child health, where we're working with our babies right up until 4 years. And we also provide you with a specialty placement where you can go out and experience some of our other core service delivery areas like the Child Development Service, immunisations, the Aboriginal Health Team, which Mel has just spoken about, and our enuresis team as well. As I said, for the PCH program, we all start together in orientation, and then we provide you with a specialised clinical skills training in both the primary school role and the child role, because we recognise that you will be coming into this area brand new with having no understanding of those skills. So we really support you with orientation and training to support you in the role. We also have study days placed throughout the program, so that's a really great opportunity to come together, to share clinical experiences, to learn, to provide additional education that will assist you in the role. And we have a dedicated TTP team, so myself as the coordinator of the program, and then we collaborate and work very closely with our staff development nurses who work within community health to do our competency skill assessments to progress you onto your way to working independently. Now, there is an expectation as part of our program for you to study postgraduate certificate. That's the Child and Adolescent Health Nursing Specialisation Graduate Certificate, and we do that alongside our program. Whilst you may be thinking, goodness, I don't want to study anymore once I finish my nursing degree, it's actually the best time to study when you're doing it alongside your cohort to help each other, and you've got myself and the uni to support you as well. So if that's an area of interest to you, again, we only do one intake, so it will be February 2027 that you'll be applying for. Again, you'll be applying for the Child and Adolescent Health Service, Perth Children's Hospital / neonatology, community health and mental health. And then if this stream preference, you will be then nominating the Child and Adolescent Community Health. Again, our contact numbers at the bottom there if you need any more information from what I have just given you. And last but not least, our child and adolescent mental health stream. So this is a 56-week transition to practice program, so the same as our PCH program. Again, it's 2 6-month rotations in acute, so here at PCH, and specialised, and that can be both in areas at PCH and out in the community that you can be allocated to. It's similar to PCH in that it's 8 shifts a fortnight, and that is on a rotational roster Monday to Sunday, or some clinical areas run by weekday hours, so it would be Monday to Friday. So depending where you're allocated in those rotations, your hours may change. Again, orientation and a specialised clinical skills training session is offered by CAMS and by our TTPP nurse educators to make sure that you're really well equipped in the role. There is a 2-week supernumerary period as well, so we don't launch you out there with no support. You are 100% supported with another nurse in those first 2 weeks to get yourself up onto your feet. We have study days throughout the program as well, and again, that's all about coming together, sharing experiences and providing you with additional education from some of those clinical experiences you might have been exposed to assist you with those and dealing with them. We have a wonderful nurse educator for that program, and again, similar to the community health program, there is the expectation that you'll study a postgraduate certificate alongside doing your program. So if this is an area of interest to you, again, it's selecting that same option again. It'll be the Child and Adolescent Health Service. There are 2 intakes for mental health. So it's the August 2026 intake and the February 2027 intake that we'll be recruiting to. So you'll select the Child and Adolescent Health Service, and then you'll select your stream preference as Child and Adolescent Mental Health. That is my presentation done. Thank you so much. Look forward to seeing some of you out at the table.
Thank you, Elise. That was really good. It's definitely an exciting area with paediatrics and neonates. Neonates is an area that I actually really love as a midwife, working in neonates. So it's something really exciting. So thank you so much, Elise.